Hi, I am Cendrick Abenoja, a first-year nursing student from Davao Doctors College, PSN 111K, and today I am going to assess the anterior and posterior thorax. But before we proceed, we must first need to review the patient's data if available, medical histories, and current treatment procedure. This is done to identify the patient's instances of harm. Next is to determine the scope of the assessment, which is assessing the anterior and posterior thorax and lungs using the IPPA or inspection, palpation, percussion, and auscultation to know the extent of this physical examination. Now, the equipment needed in this assessment is first is the stethoscope. It is used to hear the breath sounds of the client. Next is the marker. This is used to mark some parts of the body of the client. Next is the centimeter ruler. This is used for measurement. But before we formally begin, I am going to do the hand washing technique. Why do we need to wash our hands? We need to wash our hands to avoid microorganisms transmission that can possibly cause illness or disease. Good morning, sir. My name is Cendrick Abenoja, your student nurse working with you today. Before we start, sir, may I know your name?
Randall Cadena,
When is your birthday?
January 5, 2009.
And how old are you?
13 years old.
And what do you want me to call you?
Sir,
Alright, sir. So today I am going to assess your thorax, particularly your anterior and posterior thorax, and also your lungs. And for this assessment, I also need to inspect, palpate, percuss certain parts of your body, and auscultate or listen on your breath sounds. And there are some movements that you should to follow. Is that alright with you, sir?
yes,
Do you have any question or clarification, sir?
no,
And also, sir, rest assured that all the information will be gathered today will remain confidential, okay?
yes,
So as you can see, sir, I have already closed the door and fixed the curtain so that no one from the outside will be able to disturb us while we are doing the assessment. And may I ask you, sir, is the temperature alright, or do you want me to adjust it?
no,
Alright, so before we begin, sir, I let you first remove your clothes and put on the examination gown if available to easily assess the parts that needs to be assessed. Will be that alright with you, sir?
yes,
You may now take off your shirt, sir. Okay, so let's start for the surveying and surveying the chest and respiration. Check for the size of respiratory distress or problem with oxygenation. So I'll be palpating your trachea, sir. I'm going to touch your suprasternal notch. And okay, sir. Okay, sir. May I see your fingernails, your face, and your lips? Okay. Now I need you to stand up here, sir, and turn around. This is to inspect your chest configuration, which is the overall structure of your chest. Now, sir, I am going to observe the three normal curvature, which is the cervical, thoracic, and lumbar. Okay, can you bend forward for me, sir? Like you're trying to tie your shoelace. This is, I'm just looking for any deviation or abnormal curvature of your spine, which is you don't have. Okay. Now, sir, you can now stand back, sir, and sit down. Relax, just relax, sir. Now, I'll be palpating your skin to assess temperature and integrity of all chest skin. So, if you don't mind, sir, can I touch your back, sir?
Yes.
Sir, I'm just using my dorsal part of my hands because again, our dorsal hand is um sensitive to feel heat body temperature. Okay. Okay. Sir, I'm going to palpate now using my palmar to assess if there is a tenderness or bulge. Okay. Then now, I'll be palpating for the respiratory excursion. Respiratory excursion is the movement of the thoracic diaphragm during breathing. So, sir, I'm going to palpate now your lower thorax and now, sir, I'm going to ask you to take a deep breath while I'm placing my both hands to your back. Okay. Inhale and exhale 3 times. Okay. Thank you. Next is I'm going to palpate for the vocal fremitus. This is to assess for increase or decrease of lung density. Now, sir, I need you to count 1, 2, 3 whenever you feel my hand touching your back, okay?
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
And now, I'll percuss the thorax to assess for your lung resonance. So, sir, I need you to cross your arm over your shoulder and bend your head. This is to separate the scapula and exposes more lung tissue to perfusion. So, sir, I'm going to hammer your back. So, um, okay, sir, don't remove your hands yet. Is it okay with you, sir, that I am going to mark your back?
Yes.
Okay, now, sir, I'm going to instruct you to take a deep breath first and then exhale, okay? Wait for a while, okay? Inhale and hold it. Um, okay, I am going to do on the other side. Um, okay, just same procedure. Okay, thank you. And now, sir, I am going to measure your thank you. After that, we will be oscillating for your breath sound to assess for airflow through the airway. So, sir, I'll be listening your breath sounds and I need you to inhale and exhale with your open mouth, okay? Okay, now sir, I need you to repeat the word 99 whenever I put the stethoscope on your back, okay?
99, 99, 99, 99, 99, 99, 99, 99.
And now sir, I need you to say the word letter E whenever I put again the stethoscope on your back, okay?
E, 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 E.
Okay, now lastly, I need you to whisper 1, 2, 3 whenever I put the stethoscope on your back again, okay? Thank you. Now we are done on the posterior part, sir. You may now turn around and face on me. Now, sir, we are done at the posterior and now we are going to check your anterior. So, now we need to inspect for the breathing pattern and the coastal angle and the angle at which the rib enters the spine. Also, palpate the anterior thorax for tenderness, sensation, surface masses, crepitus, and femmitus. So, sir, I'm going to place my hands. Just tell me if it hurts anywhere, okay? Then we need to palpate the respiratory excursion. It is the movement of the thoracic diaphragm during breathing. Sir, I need you to inhale and exhale deeply, okay? Whenever I put my two hands to your lower rib cage, okay? And now we need to percuss the anterior thorax to assess the lung resonance. So, sir, I'll be percussing your anterior thorax. So, same procedure on the posterior that I'm going to hammer your chest again. Okay? Thank you. Now we need to auscultate for breath sounds, adventitious breath sounds, and voice sounds, specifically in the trachea and in the anterior thorax. This is to assess airflow through the airway. And since we've auscultated the trachea a while ago, we'll now proceed in auscultating the anterior thorax. So, sir, I need you to inhale and exhale deeply with your open mouth, okay? Whenever I put the stethoscope on your chest. Alright, sir. We are done with the assessment. I just want to sum up everything that we've covered. So first, sir, I noticed that your lips and nail bed are purplish due to the maybe an insufficient of oxygen in blood. Your scapulae are symmetric and equal horizontal position as well as your shoulder. Your spine is also vertical aligned. While palpating your posterior and anterior thorax, your skin is intact and the temperature is warm to touch. No tenderness or masses. And during the palpation of your respiratory excursion, I noticed that you have an equal chest expansion. I also need that while I also noticed that while you're counting 1, 2, 3, 1 to 3, there is an increase in your fremitus while I was listening your beat sounds. It has a chorus crackle with a loud. low pitch, and longer lasting. Your breathing is also labored while measuring the diaphragmatic excursion. It is at 2.5 centimeter between full inspiration and full expiration. And instead of hearing resonance, I hear dullness, short note sound, which is purely because of your pneumonia. So is that so that's it. That was the finding that I gathered throughout the whole assessment. Sir, do you have any question or concern?
None.
Again, sir, I just want to tell you that all the information gathered in this assessment will be kept as confidential between you and me and your attending physician. Alright? I'll just give this to your attending physician and I'll be back to see you. Thank you for your cooperation and God bless and keep safe.